Maine Podcast is a free media source with a mission to provide better transparency in the market to connoisseurs, medical patients, recreational users, store owners, growers, extractors, and everyone in between. This is made possible through generous support from our sponsors who cover all corners of the great state of Maine. Special thank you goes out to Treeline Cannabis, Planet Tim, Watered Roots, Rugged Roots, The Heady Yeti, Tastefully Baked, Cure Cannabis, The Shack 420, Humble Family Farms, Canna Melts, Salty Cultivation, The North Fire, Highbrow, Team Green, Seaworks & Co., Bathe Space, Zero Gravity Extracts, Wisely Cannabis, and Stoner & Co. For more information on how you can support those who support us, please visit our website, www.mainpodcast.com, and click our sponsors tab. What type of lab were you involved with labs before Nova Analytics?
Yeah, so I come from an industry, medical, urine toxicology, blood, oral fluid. So we did like drug testing, also some pharmaceutical development works. We looked at pharmaceutical formulations and the compounds that they had in them. What's interesting is myself and my business partners, we came from an industry that was very highly regulated, from the FDA, from multiple state organizations, national organizations. And quite frankly, there's a good reason for that, is that the results that we were putting out at the end of the day, they were wrong, could potentially be the difference between a person getting the correct medication for them, could be the difference between getting a right or wrong diagnosis, and in worst case scenario, it could actually lead to death if it's wrong. So there's a reason why it's so highly regulated. It's because the answer needs to be right, and there needs to be a lot of quality control checks along the way. That's something that when we were looking at the cannabis industry and said, yeah, that's really what we want to do, is we wanted to bring that eye for quality and correctness to this space, because quite frankly, we found that it was lacking. We were out west in a few laboratories helping people and doing some other things, and they needed that help, and we realized that we could do it better ourselves, right? And we were excited to do that, so here we are.
Does it feel like it's been... you were telling me the story before we got on mics that you had approached Dan because Dan had some experience out in Colorado prior to. What, in labs or something else as well too? Or was it predominantly lab time?
Yeah, they were all cannabis testing labs. Yep.
They were all cannabis testing labs?
Yep.
Was that your first introduction to getting into labs? Or what was it before?
I had a brief stint. So, I mean, after I got my master's degree, I just packed everything up and moved out to Colorado. And my first job was in an environmental lab. I was testing, mining effluent water for contamination, dirt, soil. Not super exciting. So I got an opportunity to work in a cannabis lab, and I was like, this seems way more interesting. There's not a whole lot we know about cannabis, so I was excited to do some research and try to figure some stuff out. So that's kind of where I got my foot in the door. And just to kind of add to what Chris said, I think that, when we talk about good and bad players in the cannabis industry, we like to leave labs out of that conversation. But I've seen what kind of happens at some of these other labs. I've seen the lack of quality. I've seen, corners get cut. A big reason why I joined Chris and his business partners is because they do care, deeply about the final result. They want to raise the bar for the science in the cannabis industry, and I wanted to be a part of that.
Am I right in thinking California had a problem with that years ago, or maybe perhaps still? And maybe this is hearsay, maybe not, but I remember hearing stories from a few different sources saying, like, if you fail the test, you can always pay to have another one. And,
yeah, it's very true.
And all your issues are solved.
I think one of my favorite stories, because
you've heard that
ridiculous.
Then, right?
There was a lab that went to be inspected in Washington, and the inspectors show up, and it was a completely empty facility. Somehow they were reporting results. So they were just getting paid to report fraudulent results. I mean, that's an extreme case, but lab shopping, shopping around, finding the best number and things, and there's a lot of things that. A lot of variables that go into testing. Sampling is one of the biggest ones. this product is not very homogeneous often, especially when we're talking flower, and a 10-gram sample out of a 10-kilogram batch from day to day can actually vary a little bit. So you.
Oh, so if, say, you tested something, you mean like if you tested something on day 4 of having it?
It's actually just
as opposed
because
to day
the
5 or
sample
6?
is actually different. Like when a plant grows, it's just like, any organism. It's not identical everywhere. So there's variability in how you sample and where you sample from and submit that for testing. One of the things that we do is we take very large portion of that sample. So for the adult use testing, they have to submit quite large portions of material. We don't actually need all of it to run the analytical test, but we use all of it to homogenize, mix up. So we essentially make it into a fine powder. So it's very averaged out, and test that. So it gives an average number of your entire batch, as opposed to, this bud may be 16% THCA, but over here it's 32%.
Does breaking it down change anything immediately?
No, a mechanical kind of breakdown of it does not.
And that's what it is? It's a mechanical
It's a
breakdown
mechanical
of it?
sort of.
Yeah, I was going to say you
breakdown
couldn't
process.
introduce any kind of temp, or you can do also something else I've heard about flower in particular is that a drier flower will test at a higher THC level. Can you help me? Is that a myth or is there truth to that?
No, it's true. I mean, most of the time the result is reported in percent weight. So if you dry it more, there's less water. It's, that water weight is gone. So your percent weight by THC is going to go up.
So they're only really kind of just cheating themselves at that point of a true score.
If that's the way that you intend your product to be received and smoked, then I don't think that there's anything wrong with that.
Right.
I think it's just, it's however you want your product to look at the end of the day. That's how you should test it. That's how you should put your label claim on it. Does the consumer no good if, you just dry out one sample submission and send it to the lab and get like a crazy high number, and then you send all the rest of your product in, not completely dried like that? It's kind of a disservice to the end consumer.
Mm-hmm. Well, is the percentage of THC really truly it's a factor for the state more than and the user, but I don't know if anybody's really, years ago you'd use Leafly to get your THC percentage, and we know that that's not representative of what you were actually going to get. It was kind of ballparking it, sort of. So, and I've talked to people about whether that's important to them, and very few feel like THC level as a consumer is important. So is it really because we want to make sure that people are aware on the THC level, especially maybe more an adult use program where they're not as familiar with the product? Is that where it comes from?
I think in the medical community, you have people that really find their product. They know what works for them. They're a little more concerned with the whole product rather than just the THC percentage number.
Mm-hmm. Yeah.
But
more into the terpenes.
Yeah, I think that's starting to become a big area of focus. I think we'll see in the next few years flavonoids become this other class of compounds that we start to look at.
Flavonoids?
Flavonoids, yeah, like flavor.
Okay.
They're the other types of compounds that give flavor and smell and stuff to plants in particular. Where there's hundreds, I don't know, probably thousands of those. In the adult use program, I think it's important because you do have somewhat naive people. Mm-hmm. You also want to, protect them from. You want people to learn how to use the product too. I know for me, when I look at an edible, 10 milligrams is like my max. Like for me,
that's your comfort zone. You figured that out.
And other people I know can pound like 400 milligrams worth of it. I don't know how the heck they do it, because you wouldn't see me for probably a week. Yeah. But this information, and it actually, with medicine is supposed to be very consistent, right? So I actually think that it is important. I kind of retract what I just said. I think going back to the idea of
THC levels.
Yeah, this is medicine. If that's the compound that means something to you and you find that improves your health, you do want to know the amount in there because, if I took 100 milligrams of Tylenol today, I don't want to get 1 milligram of Tylenol tomorrow and expect the same effect.
Yeah,
you're not going to have those drastic differences, I'm sure, but you still want to have some consistency in your medicine.
No, you do. Yeah. Are either of you users of cannabis? Yes.
Yeah, I do.
Is that fair to say, or no?
Yep,
That's fair to say.
Okay. Thank you.
For me,
Just checking.
For me personally, I'm someone that it really affects. I use it sparingly.
Uh-huh.
5 milligrams of a gummy is plenty for me.
No, having worked a storefront before, a lot of the patients who were coming in had already had a good deal of experience. Ones who were at the immediate, when stores were slow, it was a pocket or a handful of patients. Very knowledgeable, though. They could come in and quiz you.
Yeah.
They really wanted to know. But then as time went on and there was this familiarity from stores and new people were getting and older people were getting patient cards, there were a lot more questions. There were a lot more answers to be needed, and there wasn't any kind of resource to give them outside of your own experience. So that 5-10 milligram dose on edibles, yeah, that was go to sleep. We kind of winged it. We said, yeah, that's what you want before you go to bed. And that's what they wanted it for. So seemed like it was right, but we always, wanted them to err on the side of caution the first time through. Cut that in half. If you don't feel anything, double it tomorrow. You're only dealing with 2.5 to 5 to 10, hopefully.
I think
Find that
I don't
range.
remember the exact statistic, but almost majority of the hospitalizations related to cannabis are overdosing on edibles.
It is, isn't it?
It's that delay of onset and then overdosing for sure.
It is, yeah. But beverages hit just like that, or 10, 15 minutes later. So it's kind of a true.
We're still learning that's interesting kind of space that we'd like to get into. The bioavailability, how does your product actually get into the consumer?
So you guys are working with caregivers. You're trying to help them not only with the test results, but by going into their space, giving them kind of information that you've learned or that you can share. Or do they seek it out from you, or is it something just a quick service that you could offer?
Yeah,
Not a free consultation. Just a consultation to get in there. Is that what you do?
So every person we engage with, like I said, we kind of approach it from a partnership. We tell them everything we do, how we can help them. They ask us. We're there, I think, mostly. I think in how we got into those different areas. We're here to listen to their issues and questions, and we're scientists. We like to find problems and find their solution. So that's kind of how we got into a lot of that.
And how's it working?
I think it's working great. It's been great experience for us. We've learned so much.
Yeah.
Getting new requests for different analytes and different technologies regularly. And I'm kind of one of the ambitious ones that's like, oh yeah, we can do that. Let's learn how to do that. We'll get that in. We'll work on that.
Implement it within what you guys are offering.
Yeah, and there's a lack of understanding and research, and that gives us a really good opportunity to innovate and come up with those things.
Yeah, we really want to push the science. If there's a way for us to better serve a cultivator to help them troubleshoot a problem, make their processes better, we want to be that partner. I think there's a lot left to do in the cannabis industry, especially from the science side. There's just a lot we don't know.
Oh, a lot we don't know, yeah. I think your accessibility is I think you guys are going to do really well. I think that willingness to be accessible and to want to work with them. To be honest, what other lab, I've never heard that concept before associated with labs. So I think it's a really good move.
Yeah.
Thank you for offering it that way to the community. I'm sure with a little bit more exposure or however it is, you guys will, and the different things you're doing already, you're probably going to be jamming. You're going to think of upgrading just like they did.
Yeah, I hope so.
More lab space.
Yeah, that would be fantastic. But at the end of the day, rising tides float all boats, right? To reuse one of those sayings. But we're scientists, and myself and business partners, and why we chose to bring Dan on is we're here for the long term. We're not here to make a quick buck. We're here to support people who are running businesses.
Yep.
We're here to do the right thing. At the end of the day, we are here for public safety. So that's one of the things I like to get across. We're going to help you do the best thing that you can do. We're really customer focused, kind of centric organization. At the end of the day, it's the person that's using the product that we are protecting. Our seal of approval goes on that product, and we're going to do the right thing and make sure that someone can look at that seal and say, I trust that this is safe.
You brought something up earlier. You were talking about testing within the room, talking about doing something safe. It's not required yet for what tests are required on a medical level right now? Are there any?
In the medical level, no.
On the medical level, there are none.
I think
required.
There's the new proposed rules that are coming out.
Mm-hmm.
I think there's a line in there that says if you're going to label your product with the % content of something, you have to use an approved laboratory. So that would be like a accredited lab like us.
That would be
you can't test your strain like 2 harvests ago. It tested say at 32%. You can't write that on every product from now on.
Yeah, right.
You're going to have things tested by batch. I think there is legislation in the works this summer maybe that would make testing mandatory in the medical community. Honestly, I haven't followed it terribly close. A lot of clients ask about it, and I've had some conversations, and it sounds like actually as a whole, people are supportive of it.
As a whole. I'm surprised when I hear the other argument that they are not for testing. And I don't know if they're citing it from a monetary point of view or because in their eyes, look, if I gave you 2 or 4 samples from this space, that should be enough. And if I'm not mistaken, I believe they feel like they're going to have every strain tested that's grown in a room. So it kind of minimizes. So I don't know. I don't know all of the legalities.
Yeah, there's a lot of aspects that go into that conversation. Obviously, adds to your overhead. Right now, like for the adult use tests, runs to you about $300 for an entire batch. A batch can be up to 10 kilograms, but batches can be much smaller, so it has different impacts for different people. Right now, testing costs are pretty low.
It is
in comparison to some other states, and I'm happy that we can do that. I think the other aspects of
in some cases, any added cost is too much of an added cost.
For sure.
And they've got to be realistic about it. Too many people, I've heard it, and I'm sure that you have too, that when they talk about their medicine and it's good and it's always been good for their patients, that's not necessarily the truth of the matter. How open is somebody being about that? I mean, knowledgeable enough to know about that. So I just don't know if it's there.
Yeah. So, I mean, here are some of the hard facts. We're testing pesticides now, and of the people that are asking us to test, we're seeing up to a third of those containing some pesticides. And some of the ones like Eagle 20.
Yeah.
I don't know where they come from, or these are mostly people that are bringing product in and want to have it tested for their own, purpose. But
Eagle 20, I've heard some division on. I don't know if you can speak on this as well. Both of you, I'd like to hear your opinion. It's systemic, is it not? Is it one of these that even if you were to spray it when they're babies, when they're seedling or not seedlings, but beyond, they're very immature, they're still in their solo cup size. I've heard many growers say and try to justify that that's okay to do in their veg room. And I don't buy it. I don't believe it. I don't think it can be it's one of these that can be used in any. And it's not that it's, well, go ahead.
With the levels we're looking at, I wouldn't even bring a pesticide into my facility where I was growing cannabis. I wouldn't even risk it. And many of these pesticides, they've been banned by the EPA. There was what was called the Dirty Dozen in the 70s, where they were just spraying these pesticides everywhere in agriculture. They come to find out, they were finding it in the water.
On a water source nearby?
Oh, yeah, and miles away from the source and stuff. A lot of these pesticides are very persistent in the environment. So if you spray it when they're young, there's nothing to say that it's okay when they're a mature plant later on.
Yeah. Years ago, they could still be in the ground places.
Yep.
Like they're very stable compounds. That's why they work so well at disrupting life.
Oh, really?
So they hang around. So one of the things that you might have heard a term when talking about cannabis is that they're excellent bioremediators. They suck a lot of stuff up and they grow like a weed, right? So if you spray a little bit of equal 20 myclobutanol on the plant at a young age, it's still going to be there, still going to contain it later on. That one's
but okay. But does it become broken down enough, or does it become minute enough? No, it doesn't, does it?
We'll still see it. Yeah.
Just it should never get in there.
Yeah, and that one is particularly bad because when you heat that compound, it actually turns to cyanide gas. That's what gets people sick. Now there's other things, but that's one of them.
First of all, we realized that Maine is a really large state, and we're not exactly centrally located, being in Portland, Maine. So we are doing sample pickups. We'll go out and pick up samples for you. We have a driver that'll coordinate, and they'll also will come out on site. The Maine CDC and the OMP, they require a lot of information to be captured during these pickups. We'll come out and we'll do an initial training. We'll kind of help educate. The I's you need to dot, the T's you need to cross before you can send your sample off to get tested. So we have a whole agenda for that. We'll come on site and we'll walk through it with the client and help set them up for success.
So taking away the fear of the whole,
it's the documentation and also the correct way to sample and prepare your sample for testing so it passes as it should. Don't add some other variable in there.
And they're trying to run a business, and time is money. And it's not quick to resolve these problems when they come up. OMP doesn't necessarily move fast. Metric is a system that everybody's going to be forced to interact with and use. And when there's a problem with metric, as simple as just a number being recorded wrong. And sometimes you got to wait 2 or 3 days for that to be resolved, and nobody wants to wait an extra 2 or 3 days. So we try to go up. Train them up front so that we can avoid those problems down the line. Do you have anything you wanted to add to that, Chris?
And one of the, I think, pains of metric is getting the information in and out of it, properly ordering and being compliant with all the different pieces of data we need to capture. We are launching a metric integration, so you'll come into our system online and scan your metric tag, and it kind of sucks some information out of metric, puts it into like the order form, knows what you need to order and all your like weights and temperatures and things. So you enter a few keys and hit send, get a printout, you get your metric manifest, put them together, and we're ready to go. We're trying to take a lot of the headache out of it. And
you're bringing one of the only seemingly good lights to the metric system and how you're using it.
Trying to limit our interaction with it.
I haven't heard many good things about it from people, but did you use metric out when you were in Colorado? Was it the metric system, or was it green? It wasn't green bits. No,
it was the metric system.
And
it was when I worked in Colorado during the time where the metric system was kind of born. So it was even worse at a time, if you can believe that. And so I have a lot of experience with it. I know it's not easy. I know it can be confusing, and it's one extra step that a lot of people don't want to take. I'm really excited that Chris has figured out a way to integrate our system with it. It really is. It takes a lot of the headache out of the whole process. It's nice.
You're able to link up with other people's metric systems, obviously, given an acceptance to be able to share information or.
So when actually it's all on their end, they have a way to log into our system, and they can drop something called their API key in, and it allows them to connect and talk to metric.
So would there be a reason to? You're always dealing with, say, a cultivar or a caregiver or extractor as well. There is any reason to work with stores?
Sometimes a store might want to do their own non-mandatory R&D testing. Maybe they want to confirm. Maybe they, have a reason to test
particular products that they're carrying.
Yeah, we tested products for people, just a regular consumer, someone that wanted to verify, or maybe maybe they did something to the product back at home themselves. So there's a wide variety of people that we test for, but yeah, mostly cultivators and manufacturers, right? The finished product batches.
Yeah, I think the biggest thing, the most common thing I see when we test for store is people are concerned about the shelf life stability of the product. Sometimes it's hard to tell how long it's been there, and it easily could have changed over time, especially if you're talking about food. You know, a lot of food comes with, you buy it at the grocery store and it says it has a use-by date. I don't think you find that enough on cannabis
the
retail
edibles.
products. So I've had a number of people concerned about that, bring it in and ask me to test it for some contaminants that they might be concerned about. You know, they're wondering why it looks the way it does. It doesn't look like the picture on the label, for example. And I think that's legitimate. We also have a number of clients that actually care a lot about what their product's going to be after it goes to the shelf. So we actually do shelf life study in the lab for people that ask for it.
I thought about something while you were talking there, and I don't mean it to be a slightly off topic, but you were talking about things that you're testing and going into organic growers. Is there something, I think collectively they always, not collectively, this is, I don't mean to broad brush stroke it, but they feel as though the tests are going to take into some of their feeding methods or just what the whole medium is like, that it will cause them to fail, or it might heighten some numbers in different categories. Have you heard? I thought through other states I had heard that talked about, and some of the organic growers around here were concerned about it as well, or deemed.
I've not gotten that feedback yet.
No, it doesn't come up, or it's
No,
not
I
like
haven't
that.
seen a major difference between people who grow organically and not organically.
Yeah,
Now, I haven't intentionally sought out that data. So
Sure.
It's just something I'm not familiar with.
Most of the things we're looking for are things that shouldn't be there, period. So if they're there, like from the safety aspect of what we test for, if they're there, whether it was done organically or grown not organically, it's still, I haven't seen the organic growth. Maybe you're talking sometimes like beneficials and using some of those. Some of them are bacteria, some of them are bugs, and they might.
yes,
I guess there's a little bit of, now if we're talking about that side of things,
more of a
there-
living soil, or
there's
call it
sometimes some risk,
no-till.
I guess, associated with that. But as long as you keep those areas, the soil separate from the plant, and there's not contamination, things aren't moving, I haven't seen an issue really there.
Okay. On our medical program, there's no testing. On our adult use program, what are we testing for?
So the required tests right now, water activity, moisture content. So those two tests determine if your plant or material is suitable for microbial growth. So it goes into the stability of its shelf life, really. Microbials, right? Make sure the product is clean. Potency, so cannabinoid profile.
And that's required.
It's required. And am I missing anything else?
Filtered form
Filtered
materials.
form material.
Homogeneity.
On
A requirement for concentrate matrices, but not for flour. And all homogeneity is just, you take different samples from different places of your concentrate and make sure that the numbers are close enough to each other so that you can't grab from one part of your batch and it's completely different from the other side of your batch, for example. One of the tests that the OMP is going to roll out next is heavy metals. That's one of those tests where, I've gotten feedback from clients before where they're like, how did we possibly fail for heavy metals? And it kind of ties into what Chris was talking about earlier, where cannabis is an excellent bioremediator. If you have these heavy metals in your soil, if they're in your water that you're using to water the plant, it's going to suck it up and it's going to, incorporate that into its own living tissue. And that's more often than not, that's why people fail for that requirement. So, it might be prudent for some of these people that are in adult use to, try to do a spot check, see where they're at. It'd be better to kind of get a glimpse of where you stand now before they roll that test out and make it required, so that you're not caught off guard. You've already set forth on a 3-month growth cycle and you have this 10-kilogram batch you can't do anything with.
Yeah.
So I'd encourage people to kind of try to get ahead of that.
they don't allow remediation for 2 tests. Heavy metals, I think it's just the two, heavy metals and pesticides. So if you fail a compliance test for that, you have to destroy your product. There's a toolkit. There's some tool in your kit you can use, just R&D testing, where you submit something not for compliance testing, and only you get the results for it, and you can, like Dan is saying, start testing now, know where you're at, so you can better plan for the future. And those tests coming online.
Back in January, there were only two labs in Maine that adult use businesses could use, correct? Are there more than that now?
There's only the two of us
Only the two of you.
right now. I think there's a few more coming online. One of the things, what's interesting is we have all of our tests up and running. So the one that Dan mentioned, heavy metals, is not yet active. It will be soon. The other two are residual solvents and pesticides. Quite arguably, they're the kind of two most dangerous classes of compounds that we really do need to make sure these products don't have in it.
Tested for.
We're ready to test for them. We have actually, based on the size of the adult use market right now, which is kind of small, we actually have the capacity to do all that testing. So we're just waiting on the OMP to really put that plan into gear and make Maine a.
How come you think it's that those are faltered or not been addressed in the front end of things? Did it just not?
The availability from the labs, I guess. What was communicated as being feasible and in place. We put a lot of effort into our startup of being a full service laboratory, and one of the things we wanted to do was be ready for all that. And we're testing we're using those assays. We're testing because we have a lot of people in the medical community and even in the adult use community that still want to know and provide that information. But from my perspective, I think pesticides and residual solvents are actually the two tests that are most important to get online.
And it's not like you don't have every account from adult use. You're going to have who comes to you, who has to submit to you. But has that increased to
it's been
that's continually
very
been increasing,
growth,
hasn't
month
it?
over month.
For a little over a month now?
Month over month.
Oh, month over month. Okay, yeah.
Growth. Yeah, and it correlates to the adult use licenses starting up. A lot of them, I think, are waiting and starting that transition. I think there was a news article, which I was happy to see. It's something like 30 stores are opening in Portland over the next several months, which, I think in January and February, it was like around $2.5 million in adult use sales.
Oh, wow.
And for both months. So there wasn't much of a growth there, but I think we're seeing kind of the preemptive kind of growth.
January, February. Guys started, it was in May of 2020. Was that kind of where you had focused? Am I right on that? Or is that just sort of when I started to see signs of your business online?
Yeah,
with social
so
media
we
and
were
such?
probably here about a year before getting our plans together, finding a location and starting the process of permitting and all that. It was about May of 2020 when we finished our build out. We started to have instruments come into the facility, and we started all of our validation and startup plans. And then it's the end of October, early November, we tested our first medical samples.
In October. Oh, okay. So was it strictly or straight for the adult use program, or it's open to all programs? Is it not?
The
Analytics lab.
Yeah, so exactly. So we started in medical because there's honestly no regulation right now around how to license for a testing lab, other than Portland required us to get one. And then it was in January, we actually got licensed by the state for the adult use program. We started testing adult use, yeah.
Oh, okay. Was that more they were just getting through like paperwork, or it made sense that's where your company was?
So it's a little bit of both. There's certain types of validation and data we have to produce to show our methods are accurate. They take time to review that, and then there's time for the permitting, again, specific to the adult use program, which I'm sure a lot of people have gone through.
Have like I suppose the lines or the recommended acceptance of what is a level of, say, pesticide within or mold within, and I don't want to get into it too much directly into those categories yet, but does the data come from, say, like past states like Colorado or California, or do they exist? Does it come from Canada? Because Canada has been fairly has had some large venture businesses investing into what they're doing in cannabis. Is that where the testing's coming from? Or the numbers?
So you're essentially asking the regulations, the limits, what determines a pass or fail.
Yeah, right.
Who the heck came up with that?
Who came up with that?
And yeah, so question is, we don't have complete clarity on kind of exactly how it's the OMP and a subsection of Maine CDC that wrote those rules and regulations. We do know that they looked at other states and regulations and, took a lot of data into consideration to come up with those. There's some basic kind of food and beverage laboratories out there that, they have limits that some of that stuff was applied. As a whole, there's not a lot. So they've
searched it out.
They've searched it out. And the problem, though, across the board in cannabis right now, in cannabis testing, is there's not been a lot of research done, so we don't truly know what different levels of chemicals, microbes, and whatnot, based on the way that you administer. So whether you're inhaling, smoking versus eating, or a topical, kind of what those levels need to be. So I think they're fairly conservative. We could talk about pesticides eventually, but the limits there are really ambiguous right now. It's actually a problem. They basically say there's a no tolerance. You can't detect any pesticides, but analytically, from a scientific perspective, determining zero is, nearly impossible.
Impossible.
Right.
Right.
So, Dan, you came from, you saw some things in Colorado and Mass.
I want to give a little bit of background first, if you could, and your experience in Colorado and such, and what brought you here.
So yeah, I'm a little uniquely positioned in the science side of things in the cannabis industry. I have experience in Colorado, Massachusetts, Pennsylvania. So I've started up labs in all three of those states, and the regulations vary from state to state wildly. So, none of those experiences have been the same. I will give Maine a lot of credit. It seems like they put a lot of thought into the regulations that they did implement. It's not to say that there's not more work to do.
Sure. When you say you feel like they put some work into it, more in the analytics department, in the laboratory, or as a program itself?
I would say as a program itself. So, for example, the Microbiology Limits, they referenced USP 2022, and USP stands for United States Pharmacopoeia, and that's regulations set forth by the federal government that industries across the country have leaned on to serve public health and safety. So they referenced that. They leveraged methods. They leveraged limits from that, and I think that that's very prudent and wise of them. They're looking to play it safe until they get enough data to, maybe change those thresholds. I don't know if that's in mind for them, but I will give them credit. They went out and sought, valid data to try to set thresholds in an industry that has been very much a black box from a scientific perspective.
You bring up like thresholds. It's going to be a while before thresholds are actually established for where it could be seen across. Would that be true? I mean, the more data that's compiled, is that basically the best way to maybe accurately describe what a threshold might or should be going forward?
I think we'll eventually see that. Some of it's kind of difficult. So, I mean, there's not a whole lot of toxicology data surrounding pesticides being smoked and inhaled, for example. You normally find that, you'd think, in tobacco, but I think that there's been heavy lobbying in that industry where, they don't have as many regulations they need to abide by.
Right.
So a lot of that data is missing right now, and I think it's going to take studies. I think it's going to take federal legalization until we see some of those thresholds.
So
determined
what's
by
missing
the
is the
appropriate
federal
amount of data.
Yeah. Is that what's missing? The federal legalization? That's when more R&D might go into it,
I don't
or
think
funding.
that's what's holding it back. I think that that's what will expedite it significantly.
Yeah. So there's like the phenomena of standardization across an industry, and laboratories in other industries are notoriously standardized. There's regulations that aren't within the borders of a state, but permeate, nationally, even, across countries. And to get those recommendations that you want, a whole industry to abide by, there has to be a lot of data, a lot of hard evidence. So there has to be a lot of funding and studies that are conducted. I mean, you're actually going to need some like clinical studies, multi-million-dollar animal toxicology studies, for instance, to be done to get actually a number that everyone's going to say, yes, I agree to. We're a long way off from that. Federal legalization will open the door to some of that. But I think getting back to your question, what did Maine do? How did they do it? They took a conservative approach. And I have to say that from our perspective, so there are 2 rules in the adult use program, the Chapter 1 rule, which is everyone has to follow, and then there's a Chapter 5 rule. We as testing lab have our own technical rule that we need to follow. It talks more to the science aspect of what we do. And I have to say that they have been very open to receiving our comments, to reacting to those comments. There have been some technical limitations. There are technical limitations that their rule didn't comprehend or anticipate, and they were quick to react to that. I think we can't ask them to be perfect right now, but what we can ask them is to listen and take our feedback.
They've been good in the sense that they've had an open line of communication with you about directing you, at least giving you some sort of guidance, and you're kind of forming it yourself or within.
From our perspective and our experience, absolutely, yeah.
What's that experience been like now? I mean, I know that you got stalled out last year, and that happened. I mean, I don't know how often we're going to have to prepare in that sense or that way about what happens in the market. But it certainly was a big boom for the current medical program, a chance to get their legs under themselves a little bit more, and investing back into their what was going to take them to the next level, whatever that level might be. Who are the clientele that are seeking out testing from you guys? Without being specific about who they are, but in a sense, generalized. And I ask this because we had a podcast with Sensible, which was a courier service for a little while I forget the name of the lab. They were out of Mass, I believe, but I can't remember. They had a main chapter, but they were really located out of Mass. That's where the testing would go. Yeah, I believe that's who it was. So she said that it was a lot of smaller entity caregivers who just wanted to know about their product, like what it was.
Right. So let me back up and just kind of give you an idea of the breadth of testing that we do, and I can talk about like who's using it. So kind of everyone, obviously potency and cannabinoid profile, and our assay is actually truly a profile. We look at up to 19 different cannabinoids, so a lot of the minor cannabinoids that people might be interested in show up there.
How many? This was one of my questions. How many cannabinoids are there? Well,
There's over 100.
over 100.
Yeah.
That you know of.
But there's probably even more than that.
And these 19 per se are highlighted for what we know about them, or they're
Pretty much more of the mainstream ones that have been studied and discussed and actually have a reference standard. It's something we use to calibrate instruments available to us. But yeah, there's a good 70, 80 that we aren't looking at, that as the more research is done, they might become more important to the end consumer, and we'll start looking for them.
Yeah. Okay. I didn't mean to take you off on the
No problem.
cannabinoids, but I had to ask. I thought there were hundreds, but I wasn't sure like what characteristics or what we're looking for that would determine why we would watch it or why we'd even account for it.
Yeah, it's really the information that someone else publishes and says, this one can be used for X, Y, and Z, or creates public interest in it, and it makes sense for us to start looking for it.
Are cannabinoids, how would you best describe them, like, to somebody for what their purpose is? Like what like I know like you have seasonings in a kitchen. Yeah. Cannabinoids for cannabis or hemp. Why do people want to know or need to know how these differentiate? Like what qualities or what comes of it?
So I'll take the first part of this, and maybe
Sure.
Dan, you want to elaborate on.
It's complex, and I don't know where that question comes from, but I want to explore it a little bit.
I mean, from the aspect of why do we study them, why do we have different cannabinoids, and why are we interested in the different ones and how they affect us? We have something called the endocannabinoid system that is a receptor system in our body that we make our own chemicals that interact with them, anandamide and some of these others that modulate inflammatory responses, other health conditions that, we now realize that these cannabinoids interact with those systems to some extent in some way. Learning about how they interact with the system, which ones specifically do and don't, you can potentially modulate that system. So I think everyone knows there's actually an approved form of cannabis called Epidiolex, CBD, actually treats Lennox-Gastaut and Dravet syndrome. They're epileptic syndromes in infants and early childhood.
Younger children, toddlers.
So one of the first really effective treatments. So learning a little bit about that, and that's also one of those scenarios where we don't exactly know how it works, but we know it does work and it's proven safe. So it's a win-win there. But yeah, a lot to learn.
Is it true that the endocannabinoid system is only opened up through THC or CBD type of product?
So our body uses it itself. We produce our own chemicals to interact with it. It just so happens to be, in a kind of simplistic term here, that these chemicals, cannabinoids produced by a plant, also interact with those receptors in our body and can affect that system in some way, somehow.
Okay. All right. But it is only awakened by or is it a system that's already active before?
Yep.
In our body? What stimulates it outside of, say, cannabis or
it's really a homeostasis mechanism. It's always in use. It keeps our body at equilibrium. What tends to happen for people, let's talk about inflammation. It's probably the easiest one to understand.
Okay, sure.
The system can be upregulated or downregulated and tells your body to inflame and release a lot of cytokines or other chemicals that cause like visible inflammation or pain. And the cannabinoids, the entry of those can actually help lower the infiltration of those immune cells and reduce the inflation.
So it does happen on a cellular level.
It does. It absolutely does. It's I guess maybe the easiest way to understand it is that your body itself loses its ability to regulate that system to some degree, and you can modulate or change the way that system is working in your body with cannabinoids and get it back on track.
Amazing. So we're
still learning so
we're still
much
learning
about
a lot,
it.
aren't we?
Yeah.
Yeah. Were there things that you wanted to say?
I'll add to that a little bit.
Please.
For example, Chris was talking a little bit about inflammation. CBD doesn't only interact with the endocannabinoid system; it actually interacts with immunological processes in your body. So it can interact with more than just the receptors in our endocannabinoid system, and that's still all being studied research. It's not as well understood as it should be. So there's a lot more to learn. And then just from all these other cannabinoids that we don't know about, for example, there's CBDP and THCP that were recently discovered. And there's historically, or before then, it was always perceived that the longer this hydrocarbon chain you have on the end of these cannabinoids, the more potent it is. Well, CBDP and THCP have a 7 carbon chain at the end there. So they're like, this is great. It's going to get people even higher. Turns out it binds so well with the receptor that it actually can cause adverse effects in the body. So,
oh, no way.
There's even cannabinoids out there that aren't necessarily good for public health and safety, perhaps. So there's a lot to learn.
Have you heard of, kind of get off track here, but this is an interesting kind of piece of history.
Sure.
Have you heard of spice, K2 spice? There are these illicit drugs that you've seen awful news stories on, people kind of doing some crazy things. So those are actually called synthetic cannabinoids.
Okay.
The pharmaceutical industry was they identified this system years ago, and they started in the lab making chemicals that reacted with that same system, but they produced these synthetic cannabinoids that are actually several hundred to thousands to several hundred thousands times more potent than THC.
Ooh.
And there's a real problem. DEA can't regulate them. They come from clandestine locations, and they fiddle with the molecular structure and mix it into street drugs to create some crazy effect, and people die from it. It's actually a serious problem, but
wow,
that's kind of on the outside of what we're looking at. We're looking at the natural cannabinoids, and these are safe compounds from a aspect of how we know to use them.
Are those still on the market? Is synthetic? I think I heard it termed as synthetic marijuana before, but
they're not supposed to be. Let's put it that way.
They're not supposed to be.
Yeah,
and so they haven't really kind of changed.
They're really illegal, illicit drugs.
Did you say that came from within the government,
testing
or not government
research that was done?
Research labs.
And going back into the early,
but it made it into pharmaceuticals.
Yeah.
One of those things. Yeah, you can't put just a concoction together with what you think it's going to be.
Right.
What it should be.
So we were talking about, kind of sidetracked us, but we were talking about all the different types of tests that we do, right? So we got the cannabinoids, right? We've got heavy metals. Those are toxic metals that you shouldn't ingest. Got pesticides. We test for terpenes, so it's another kind of profiling test. Look at 23 of those or so, 23. And that goes hand in hand with the cannabinoids often, kind of describing a strain. We obviously look for all the different microbial contaminants, yeast and molds and bacteria. We also look at residual solvents. So after extracting, say, with a hydrocarbon or going through a manufacturing process, you want to make sure that nothing from your process is left behind that would make it unsafe.
Is it, what's the chemical that they wash it? They do a rinse in those. Is it ethanol or alcohol-based?
It's typically ethanol.
Ethanol? Yeah. Just out of curiosity, why would something say that doesn't want to break down at a high temp, or a temp that's normally used? Well, I'm kind of getting off topic here, but just out of curiosity, why would it show up in, say, a cultivation space? Is it something that's sprayed? Is it something that doesn't tend to break down from a pesticide point of view? Or maybe not even a pesticide. Maybe it's something within the grow, just happen to make it into its medium, to its soil. Do situations like that come up, or you come across that from a lab end?
Are you speaking to any contaminant or residual solvents?
Residual solvents more.
Typically, residual solvents, we only find those in concentrate type of matrices. So they're using butane or some other solvent to concentrate the cannabinoids down. I would be surprised if we found any sort of residual solvents on like a bud or
Mm-hmm.
a flower.
Mm-hmm.
It's not to say that maybe somebody hasn't tried to do
No,
that.
right.
So we haven't found solvents on any other matrices very often, aside from concentrates.
Usually has to come from some sort of application. So one of the things is like you don't know what you don't know. So if you're applying something that you think is, the label says it only contains X, Y, and Z.
Mm-hmm.
Unless you test it, you actually don't know if you could potentially be introducing some other small amount of like one of these other toxic chemicals, residual solvents or pesticides, right?
Mm.
One of the things that I think people may have a hard time comprehending is just what like a part per billion, part per trillion even is that we're looking at. I mean, we're looking at things that are almost, they're trace levels. It's super low. So it can be daunting to tell someone that your product tested for pesticides, but they've never even used pesticides in or around their facility. But then they go back and do research. They found out that 10 years ago someone had a pesticide use in their building,
In that same space,
and that shows up.
Yep.
Or even building a there's construction going on next door, and somehow that gets into your air system and lands on your plants.
The levels are so low, it like pushes the capabilities of modern or commercially available scientific instruments that we even have the option to put in house. So like, I still remember a lab I worked at previously. We had this contamination we couldn't track down, and our pesticides testing was at a standstill. Finally figured out somebody had just sprayed pesticides, like the town came in and just sprayed pesticides outside of our facility, and it just threw our whole entire laboratory for a loop. So I still remember my lab director coming out, like waving his hands in the air, yelling at the town to not spray pesticides outside our lab. That's all it took.
Wow. So
yeah.
you've got to think about the location of where you are and how that can affect the
Oh,
air.
yeah.
It's all about the airflow, isn't it?
Yeah, our whole, we're like kind of like a clean box. We have filtered air and certain types of air handling to deal with that.
If you're going to create such a sterile environment, as stay as sterile as you possibly can, I mean, you need to invest in that type of air. Should cultivators who are indoor also be investing in air filtration systems like that to that degree?
Oh, absolutely.
What about the ones who are? No, what about the ones who aren't? It's an AC unit. It's a wall-mounted unit. It's maybe something a little bit like. Are they just opening themselves up to what type of issues are more common with bad airflow, or unfiltered airflow? Because there could be powdery mildew out in a field or trees outside, and that's going to come in. Is it not?
Yeah, I think you hit like the main thing there is like mold can easily travel through the air, and like on plants, powdery mildew is obviously a really large problem in Maine. Pesticides, you need like some carbon filter time. Yeah, there's like a lot of things that can go wrong with pesticide contamination. That one's hard to avoid.
I think it's going to be different for everybody, depending where you are, what you're trying to do, and it's all about the amount of risk you want to take. It's a pretty dynamic.
That also actually, I think, leads into like the other two types of testing that we do, and we're working on one of them. The other one we're already doing is we help with facility testing. So we'll go into a facility, we'll swab it, and look at like maybe contaminant areas that are potentially contaminated. Look at like your AC units and tell you whether like they need to be potentially cleaned or they're a source of potential
so
risk.
you're able to go on site and do evaluation,
Right? Take air quality samples and that type of thing. Give the person some information on how to combat those issues. We like to we're more of a partnership sort of organization where we like to learn your operation, figure out how we can best provide you information and data to empower like your own decisions. We're very much supposed to be that unbiased and kind of.
So, but you've become a resource now, and added in the community, in the involved. You're offering services to be able to help better somebody give them an overall look.
Yep.
Tell them how.
One thing Dan's working on now is a assay for nutrient analysis. So this would be like you would take, well, I'll let Dan explain it.
Well, so there's essential nutrients the plant has, like phosphorus, carbon, nitrogen. And there's enough data out there to tell you if your plant is nutrient deficient in one of these nutrients or another. So we're going to get an assay online to kind of help cultivars look at their plant, profile their nutrients content, and kind of get a sense of, maybe we need to add more nitrogen, maybe we need such fertilizers. So we need to look at our nutrients we're adding to our plant to get a better yield. We're really excited to get that on. I think Chris kind of hinted at it earlier. We don't want to be the lab that gives you a result and you walk out the door and that's the end of it. We very much want to be a partner. We want to help people work through problems. We want to learn from them. We want to help them learn from us.
Yeah, the more data you can get and the more people you can work with, the more efficient you become in your evaluations too,
It's
right?
about being proactive rather than reactive in a business, right?
Mm-hmm.
Lets you to spend your resources more wisely.
Is it a little bit more, so there's almost always a level of disbelief in a sense if they like you were explaining earlier, they don't use any pesticides, they weren't using any of these things, and you found the cause of it, or it was about the air or what was going on before. How often are answers, what are the most obvious answers that you've found? Like even like with, for instance, like soil.
Mm-hmm.
Can you just go into a place and see how they're actually taking care of the flow within, whether it's buckets or some different manufactured, set where it could be a whole table full of soil. And so you see different types of, it could cause different issues in that environment.
It's
just
hard.
by the container, just by what they're using for a medium. I've always wondered about cocoa coir. I mean, I think that brings on a lot of issues, does it not?
Cocoa coir, in my experience, has led to more issues than solutions.
It's mostly critters, is it not? Or do you want to talk about what?
Yeah, and big problems with mold. It's just packed, dense, full of nutrients that, and then what you do with the cocoa coir is you put it in water and you grow a plant. Mold loves water. Yeah. So it's just a medium. It's just a breeding ground for mold. And as soon as you have that in your soil, it's going to make spores and it's going to travel to your plant. And we go test in the lab, well, you're going to hit for yeast and mold most likely. So we have seen people in the past, I've seen them move away from cocoa coir for that exact reason. And then you hit on it perfectly. The critters are another problem.
They are.
And there's so much, it's just there's not to say that people can't use it and use it very successfully.
Well, I've seen like when they kind of make their own soil out of it, where they'll add a little bit more perlite or then add some other soils. And I didn't know if that changed it enough.
Yeah, I mean,
to work away from it. But I still got to believe, from what I've seen, when it's just cocoa coir to those, there's still issues, gnats or whatever, right, are going to be around and more prevalent.
Yep, for sure.
For one of the things that I've noticed. I'm sorry, you were
saying. I was just going to say, it also is like how the person is operating with that medium, how they control that. I mean, we've done actually some tests for people looking at those, and pretty hot for mold. I think there was another situation where we tested and it was clean. Mm-hmm. So, they had maybe a different procedure, different way of handling it, that different source, right? This is a raw material sourcing, knowing that your raw materials you have clean inputs, so you can expect the output to be clean if you do everything in your procedure correct.
I think like the older school growers always understood certain elements of it that would allow them to grow in a different type of space. I don't know if they figured out airflow or stuff, or I don't know if it's just a lot has to do with soil, their soil or their medium, whatever they're using. It could be their nutrient line, it could be their foliar, whatever it is. It's 20, 25 years of understanding it, or like looking at that. Do enough cultivators, is there enough experience within? I mean, there's probably that education that needs to come along too, does it not? Because I feel like there's a lot of people who are maybe 2-3 years into it, and having grown for 2-3 years, you don't learn a lot as much as you would, 5, 10, 15 years into it.
Yeah, experience obviously in anything that you do gives you an edge. For those that are experienced and maybe not testing that much versus, the new guys that are getting started out, testing actually becomes even more important, I think, for those folks because it is information data that you can use, like the nutrient analysis testing that will launch soon. That gives you an opportunity to see a deficiency, react to it before the plant is, yellow and dying or has, some issue associated with it. Can catch that early and make your adjustments. You can learn. There's obviously tons of information out there on cultivating now. So I think people are adapting a little quicker. But if there's, and I'm not a cultivator,
Right.
but I just know how our data can help people operate better.